micro recall questions, because on the day of examination I got some first hand information. Some questions we don't know the exact options, exact questions. Now we have enough time. So I got lot of feedback from the kids. Based on that, here the detailed discussion of micro questions. Got it? Hope audio video everything is okay. Great. So excellent feedback, everything from the notes. See, if I am giving 300 pages notes, 500 pages notes, taking 5 days class, if I say 80% strike rate, 90% strike rate, that is not surprise. Taking 22 hours class, 100 pages to 120 pages notes, and 95% to 100% strike rate, that is called real success. Got it? Right. With this, I'll go to the questions. Yeah. First question. Child with anal pruritis, microscopy of the pathogen shown here. Choose the correct pathogen. You are all aware of that. It is kidney-shaped egg. So you must know about all the eggs. Any microbiology competitive exam, parasitology, it should be cakewalk to you. So it is plano-convex egg. Plano-convex kidney-shaped egg. And anal pruritis. You remember my mnemonic? AAA, anal pruritis, autoinfection, appendicitis, and albendazole for Enterobius vermicularis. So if you read all the eggs, many of my TND, my Telegram group, everywhere you have that. I don't want to give evidence for all the questions. Every question we have the evidence. I taught you many times. All my TND, this slide is default. All my fast track, last minute LRR, everything, the slide is default. If you know the slide, any question comes from egg, you can answer. Got it? I made it easy. Next is Trichuris trichura egg, you can get barrel shaped egg. Ascaris, you have serrated edges. Ankylostoma, clear shell with blastomeas. You remember? Right. Easily you can answer. This is a direct question. It is a direct question. Next is match the blotting methods. There are 3 blots are officially announced. Fourth one is enzymes for post-translational enzymes. But you know the mnemonic. It's not my personal mnemonic, but my teachers taught us. Typical Indian mnemonic. What is it called? North Indian people, roti. South Indian people, dosa. Western people, pizza. What is missing? Eastern is enzyme. Even if you don't know Eastern's enzymes for post-translational proteins. So the answer is A is 3, B is 1, right? C is 4, D 1. This is the answer. This already we have taught you. There's one more mnemonic called snowdrop. That also I used to teach. Snowdrop. I used to tell this is USMLE class I used to teach. It's not Indian. South DNA, North RNA, Western. Easily you can answer. These are 100% scoring question. This time microbiology is a cakewalk to you. It is not a nightmare. It's not a horror show. So I'm happy. Third question. HIV positive, PLHIV presented with dysphagia and odinophagia. White plaques observed in upper J endoscope. Odinophagia, dysphagia, white plaques. This is esophageal candidiasis, oral thrush. Biopsy may reveal. Biopsy may reveal. In GI endoscope, if you're able to see white plaques, the upper J endoscope, biopsy may reveal yeast with pseudohyphae because it is due to candida. Pseudohyphae indicates invasive candidiasis. Pseudohyphae indicates invasive candidiasis. Multinucleated giant cells you can see in herpes Zangsmeer. Aseptate hyphae you can see in mucormycosis, acid fast bacteria, tuberculosis. This is also direct question. Without panicity, you can remember. I remember the mnemonic from the class are very helpful. Thank you, Dr. Shurbi. Next is choose the auto-infection causing parasite. Auto-infection causing parasite. There is a mnemonic for you. Remember the mnemonic called chest. This is the mnemonic called chest. This is the question I used to teach in the class. In the regular class, the same question will be there. Okay, this is chest is the mnemonic, famous mnemonic for auto-infection causing parasite. Okay, so here use the mnemonic, it may create some problem to you. Chest. Okay, strong Lides stercoralis. Yes, it causes auto-infection. Not Ankylostomia duodenale. Hymenelepsis dana, it also causes. Cryptosporidium, Enterobius vermicularis, Taenia solium, not Taenia saginata, Taenia solium. This is the mnemonic, everybody knows. But here the question is one answer, single choice, not multiple choices. So which one you are going to choose? Strongyloides or Hymenelepsis nana? If two people are having same weightage, we need to see other parameters. If you attend my class, you remember, Strongyloides stercoralis causes different type of autoinfection. External autoinfection, internal autoinfection. I used to tell the story. Taking out of the anus canal, okay, staying in the perianal fold, taking revenge is called external autoinfection. Like Bahubali going up retrograde, penetrate in the intestine itself, internal autoinfection. So, and magnitude of the disease, common, and the what is called prevalence. If you see Strongyloides stercoralis get more votes. Both are correct answer. I don't know what they decided, INICET, but experts like us, we will go for Strongyloides stercoralis. Because both are causing autoinfection, how can they frame the question? I don't know. So among the choices, most common, for example, rheumatoid arthritis comes under type 3 hypersensitivity, type 4 hypersensitivity. Both are correct. But if you ask more common, I can go for type 4. Like that, we can go for it. But I don't know what really the key they prepared. Okay, right. Next is, all the following are dimorphic fungi except. This is a regular question in INICET and NEET. If you see last 3-4 years, it's keep on coming. See the mnemonic of mine in the class is STS. Dimorphic fungi, thermal dimorphism, 25-degree mold form in environment, 37 yeast form in tissues, right alphabetical order, 2 temperature, 2 forms, 2 places. Mnemonic is systemic mycosis, which includes histoplasma, blastomyces, coccidio, paracoccidio. And Talaromyces, previously called Penicillium orniffi, Talaromyces orniffi, Sporothrix. These people are known, well-known dimorphic fungi. Well-known dimorphic fungi. My mnemonic is STS. No need to show all those things to my kids because they are aware of that. It is in the notes. You wrote in the notes. I wrote, you wrote. Okay. Just you can recollect. I told on the exam I will be with you. Right. So the mnemonic is STS. Systemic mycosis is coccidio, histoplasma. Talaromyces is there. And Sporothrix. Here Cryptococcus is yeast. That's all. It is not dimorphic. It is just yeast. Next is treatment option for penicillin resistant gonococcal infection. Nowadays 80% of the Neisseria, including meningococci and gonococci, they are resistant to penicillin. Gonococci we call it as PPNG. What is PPNG? Penicillinase producing Neisseria gonorrhoeae. Usually the treatment is ceftriaxone and we should give azithromycin as a syndromic management. You remember I used to tell what color code pack? Gray color pack. You remember these are all in my class regularly used to tell. see if you see the notebook, you can see here. This is gram negative, kidney shape, intercellular diplococci. Every word is one MCQ, my dear. Just I gave a ceftriaxone, azithromycin. Every word is one MCQ. Simultaneously, I used to teach what? Meningococci. Meningococci also treatment, ceftriaxone. And vaccine available, vaccine indication. Got it? Everything from the notes, just 120 pages notes. And the same notes in another format is DBT. And final revision form, table format is LRR. I'm so happy. Standard questions. Next is choose the organism identified by the method shown in the image. Same image came in the notebook, in the workbook, came in the exam. Last year, sporothrix, same image came. This time Haemophilus influenza. You didn't believe? I'll show the teaching slide. This is the teaching slide. This I used to teach. This is called satellitism. How it works, I used to teach. Everywhere factor 10 available, factor 5 available after breakdown of RBC with the help of staff RS. So this is a hemolytic area, both factors available. You can get the group. This is called satellitism due to factor 5 exhibited by Haemophilus influenzae. Same picture without any change came in the exam. Got it? Choose the organism, identify the method. After seeing the picture itself, you can say, if the same picture, if you're able to get arrowhead, that is called camp test. If it is arrowhead, camp test, but it is called satellitism due to factor 5 or factor V, NAD. It is due to Haemophilus influenzae, which need both growth factor. Got it? Next is, because Streptococcus pneumoniae, they produce Draughtsman colonies. Corynebacterium diphtheriae, the selective medium is potassium tolerant blood agar. Klebsiella pneumoniae produce mucoid colonies. Choose the bacteria exhibits Kanagawa phenomenon Vagatsumagar. I used to teach Vibrio parahemolyticus, just 5 points. SS is the mnemonic. So see, this is the 5 points I used to teach in Vibrio parahemolyticus. Safety pin appearance, swarming in the medium. It is a salt lover, halophile. Seafood, shellfish or oysters. Salted blood agar, we call it as Vagatsumagar. It produces hemolysis. That is called Kanagawa phenomenon. Treatment doxy. That's all. This is the only thing I used to teach in Vibrio parahemolyticus. We got one question. Read little, retain that little maximum and reproduce rock in the exam. That is our strategy. Beautifully, it's working for you people. So, Kanagawa, you need to know about all the phenomenon. Kanagawa phenomenon. Okay. Vibrio parahemolyticus. Vibrio parahemolyticus. Next is, all the following are high risk group for HIV except. So we are having high risk people. That also I used to teach while teaching the lab diagnosis. In the lab diagnosis, 1 positive, A1 positive, remember A1 positive, A2 negative, A3 negative comes. You need to think, if the normal people, it is negative. In case of high risk people, that time I used to teach high risk. That time I used to teach what is high risk. Okay. Remember, homosexuals, men sex with man, commercial sex workers, intravenous drug users, people in asylum. These people are high risk people. Even truck drivers also high risk. But comparing with this, these people directly they will get the infection. Truck drivers, we call it as a population. They are normal people. They are the people who spread the disease from the infected people to normal people. because he's a truck driver. He go to some place, he will get the disease. Coming back to home, he will give the disease to the community. Okay, so that is a type of bridging population, truck drivers. All the following high risk group, all the four, but comparing with all the four, little less is truck drivers. Little less is drug drivers. Other all people are direct. Comparing with the prevalence, everything, it is little less in truck drivers. Little less in truck drivers. Okay, right. Next is match the following. Always there is a question from vector. This is my favorite slide for you people. This is default slide. Mechanism of action of toxin, vector, selective medium, like that. I used to tell 5 slides. Hypersensitivity reaction, like that. In the 5, definitely you'll get 3 to 4, sometimes 5 out of 5. See carefully here. These are all the vectors and the disease. If you know this, in DVT I put 10 slides. Among the 120 slides, almost 10 slides exclusive for vectors. With all beautiful video, I put each vector and the disease. Remember, louse is vector for epidemic typhus, relapsing fever, and epidemic type of relapsing fever, louse, trench fever. Okay, so louse is vector for epidemic typhus. Tick is vector for many people. Here, Rocky Mountain spotted fever. Indian tick typhus, Babesia, Ehrlichia, Lyme disease, many are there. Rat flea is the vector for endemic typhus. Mite is for scrub typhus as well as rickettsial pox. So A is 3, B is 2, C is 4, D is 1. So answer is C. So you must know about all the vectors. 100% you may get a question on vectors. No doubt on it. Next is, these are all standard. A question from vector, a question from selective medium, a question from toxin, mechanism of action. These are all common. And 2 to 3 questions from disease treatment for infections. Treatment, this time you got many questions based on the treatment for infections. Okay, one is painful vesicular ulcer question came. Neisseria gonorrhea question came. Many questions. Okay, right. Next is, choose the correct statement. Will-Flix for typhus fever, yes. All rickettsial disease, Will-Flix reaction. Vidal test done in first week of fever. No, it is on second week of fever. You know the famous mnemonic called BASO. Every teacher used to teach BASO. Standard, it is existing almost more than 30 years. Standard agglutination test, STAT for brucellosis, MAT test for leptospirosis. SAT, MAT, CAT, cold agglutinin for microplasma. These I used to teach. Okay, so here 1, 3, 4 are correct, except 2. Vidal not for first week because the antibody developed only on the second week. BASO antibody is second week. Next is, how many PCR cycles are needed to produce half amplified DNA copies produced by 27 cycles of PCR? I gave the explanation. Each PCR cycles double the DNA. Yes, because it's 2 to the power n. Got it? If 2 to the power 27, first is, for example, in case of 2 to the power 26 is 50, 2 to the power 27 is 100, because into 2, into 2, into 2. Like that. Suppose if 2 to the power 27 gives 100 copies, 27 will be 50. In case of 25 will be 25 copies. Okay. In case of 2 to the power 25 will be 25 copies. 2 to the power 24 will be 12.5, like that. So one cycle less you can remember. No need to break your heads, because many people after mathematics, it is fully concept. This is the one question I enjoyed because it is not a direct question. It is checking your level of understanding. It is checking your level of understanding. I'm so happy my kids remembering the question, they send it to me. because many times kids will forget. But always remember, the kid who really prepared, they remember the most toughest question, because the question which is not able to answer, we won't forget our lifetime. Got it? If somebody defeated, we won't forget the people like that. Okay, this question is purely thought-provoking question, and this is real standard of INICET. Next is, choose the organism have two morphological forms. Two morphological means Acanthamoeba has trophozoite and cyst. See my picture. In the parasitology first page of the notes, I gave this picture. Amoeba, Giardia, Balantidium coli and Trichomonas. Okay, trophozoite and cyst seen in Acanthamoeba, Naegleria and Giardia, except Trichomonas, because Trichomonas only trophozoite. It is only trophozoite. My first picture, first page of parasitology, this message will be there. Okay, 1, 2, 3 are correct. Basic. Trichomonas having only one form. What is the form? It is trophozoite. It is trophozoite. Next is most common HPV serotype associated with human cervical cancer. This question taken by STI dermatology people. OG madam will take this question because it's a common overlapping. Even PSM people also will take. Human cervical cancer, common serotype, pathology people can take because it's oncology cancer. It is cervical cancer, OG people will take. And sexually transmitted, so STI people will take. And it is caused by virus, microbiologists can take. This is a overlapped question by everybody, but a very easy question. Human cervical cancer is 16, 18, 31, 33, but most common is 16, 18. 16, 18 is the most common type. 31, 33 also there in the list. Don't worry. 6, 11 causes genital warts. Condyloma, genital warts. We call it as condyloma acuminata. 1, 4 and all causing common warts, as well as some plantar warts. You remember this chart. See here, I used to teach human papillomavirus notes. That's all, not much. Half page notes. Half page notes. Okay. Half page notes. You can get everything. See, 16, 18, 31, 33 human cervical cancer. Most common is 16 and 18 because see the vaccine 16, 18. Everywhere 16, 18 will be there. Everywhere 16, 18 there. Gardasil 9, Servavac, Cervarix. Anyway, this is elaborately taught by OJ madam also. Don't worry. So multiple times you got this answer. Next is patient with painful vesicular genital lesion. Painful lesion is two people. One is herpes. Another one is Haemophilus ducreyi. These two causes painful. Apart from that, you can get LGV. But LGV, it causes tender lymphadenopathy. And if you see vesicular lesion, I can go for herpes. We call it as cold sore. Herpes, vesicular lesion, genital lesion. Okay. And treatment is acyclovir. This also there in my notes. If you see, yeah, this is herpes chapter. Human herpes virus 1 and 2, trigeminal ganglion, sacral ganglion, skin and mucous membrane blisters. Okay. Herpetic whitlow, vesicular lesions, and treatment acyclovir. Few points. Herpetic whitlow, erythema multiforme. It produces blisters, vesicles. That's all. So just important key points. Every chapter learn 5 to 6 key points, and remember this, you will succeed. Got it? So my notes is concise and crisp. The people who attended my class, they are aware of that. And my flashcards are other important tools for you. I'm not self-drumming, I'm telling the truth. Okay, right. Next is an adult male patient with history of unprotected sex few months ago presented with clinical feature shown in the image. This also I am doing surgical strike in STI. Choose the ideal laboratory test. Because of that I choose this question. Laboratory test. So sexual transmitted infection, rash in the palms and soles. It is secondary syphilis. Because in my class I used to tell 3 words about syphilis clinical picture. Primary is sore, painless ulcer. Okay. Primary. Secondary is rash. Maculopapular rash, condyloma, lata, palm soles, everything. Latent asymptomatic. Tertiary cardiovascular neurosyphilis. Congenital, you have many Hutchinson's teeth, interstitial keratitis, Olympian bro, snuffles, everything. So secondary syphilis. Zanksmear we cannot useful because it's for herpes. KOH for mainly fungus. Skin biopsy mainly for human papilloma virus, those kind of Kaposi sarcoma, those kind of conditions. So serological test is best, especially secondary syphilis. 100% sensitive is there. 100% sensitive in secondary syphilis. Serology. In case of primary syphilis, serology may be useful and dark field microscope, some other things are there. Okay, so in case of secondary syphilis, 100% sensitivity, it will not miss a single case. Go for serological test. Do VDRL test or RPR test first. If it is positive, then proceed for specific test like TPPA, FTA, ABS. Many are there. Big list is there. TPI, TPHA, that is commonly used in many places. Right. Next is identify the immunoglobulin structure shown in the image. It's a basic question, so I taught it in back to basics. It is dimer. So all the immunoglobulins are monomer. Except to 2 people. IgM, pentamer. Secretory IgA is dimer. Secretory IgA is dimer. These 2 people are having a chain called J chain. Remember the mnemonic? JAM. So IgA, secretory IgA, that's a specific. Secretory IgA is dimer. See the picture. See the class notes. You see here? This is back to basics. I took the screenshot. IgA just 5 points. It is having heavy chain, alpha chain. It's called mucosal paint because it protects the surface. It activates alternate pathway. It's commonly seen in colostrum and breast milk. Serum IgA monomer, secretory IgA dimer, they possess J chain. So J chain seen in A and M. Secretory IgA and M. JAM is the mnemonic. Just 4.5 point, not much. Paragraph story. If I'm teaching IgA 10 pages or 3 pages, then I say this point is there. That is not surprise. 4 to 5 points because there's a key point. It's a key point. Yes, this is I did surgical strike from what is called to ophthalmology. They already discussed in ophthalmology, but enterovirus causing hemorrhagic conjunctivitis. Okay, hemorrhagic conjunctivitis commonly enterovirus 70. Even Coxsackie A24 also causes acute hemorrhagic conjunctivitis, but this is a common. Enterovirus 72 is hepatitis A. Morphologically, it is hepatitis A. Coxsackie B causes viral hepatitis. Sorry, viral myocarditis, slip of the tongue, myocarditis. Myocarditis. So till now we have completed 18 questions. Okay, this is elaborated version. Almost 10% of the questions from microbiology, and all are easy. If you are studied normally, my notes, attended my DVT class, 16 questions without any hesitation we can answer. One or two questions little tricky, that PCR question like that and all. If you can attend 18 also, but at least 16 guarantee. Okay, so even though any changes in this, because change is the constant thing, any choices, any question, anything changes there, you go through this. Okay, give the feedback, send it to my mail ID or my Telegram group. Best is Telegram group, Micro Magics is my Telegram group. You already remember, I know that. Anything you can post it in the group. Sir, this question, this changes to be needed. This is not the choice. This is multiple choices. You need to add or delete this choice. Everything. I'm ready to help you. Now the time is 7:30. 30 minutes over.